Hi, my name is Bianca Angel,
And my name is Tiffany Nguyen.
and today we're going to be talking about if physician assisted suicide should be legal nationwide. First, let's talk about what physician assisted suicide is. It's the act in which the physician is intentionally trying to help a patient commit suicide using various types of lethal doses of drugs. The man who came up with the idea was named Dr. Jack Kevorkian. He was born in 1928 in Pontiac, Michigan. He was arrested for almost 8 years after a 1999 conviction for accusers of murder in the state of Michigan. He believed that every patient had the right to decide what to do with their own body, no matter if it was suicide or to continue living their life.
The United States was the first of 9 countries to allow physician-assisted suicide. The 5 states being Oregon, Vermont, Washington, California, and Montana. The law passed was called the Death with Dignity Act because that's what it was. You were able to leave on your own terms versus just letting the disease take you. The first case of the Death with Dignity Act was Thomas Schuch in 2008. He had a terminal case of Lou Gehrig's disease and requested to cease all medications, helping him right then and there.
The benefits of having assisted suicide legal is that the patient knows that they're in control of their own body. No matter what the outcome is, if they choose to continue with the process or not, they have control of their own body. Even after the patient receives the doses of medications, of lethal drugs, they can decide when and where to take it. They can even change their mind if it comes to that point in their lives that they're like, no, I don't want to do it. It was the wrong decision for me. Then they don't have to take it. But at the end of the day, they are the ones that can choose whether or not to have this procedure to be go. And for many patients, that's the best thing because they don't feel that they're useless because of an illness, because they feel that they can still overpower this illness in meanings that some people might not understand, in the sense of committing their own suicide to help them achieve another type of peace that not everyone might understand.
To qualify for physician-assisted suicide, you have to be a current resident of one of the states that allow it, which means you can't be a resident of Massachusetts and decide to move to Vermont just to have the procedure done. And you have to be 18 years of age, no exceptions to this rule. You have to prove yourself mentally capable, proving yourself that it's not just a phase and you're actually serious about this commitment. The most important part is that you have to be diagnosed with a terminal illness with only 6 months to live. So in the end, death is unavoidable. It's just up to you which way you want to go. It has to take 2 physicians to determine all these qualifications are met, and finally, you must be able to take the medication yourself, so in the end, your life is actually in your own hands.
This is a very controversial subject, not just for the patient in general, but for many physicians. Many physicians, before leaving medical school, make an oath that they are in every way, shape, or form going to help this person no matter what, and they're going to make sure that they are going to do everything in their power to make this human being be as healthy as they possibly can. This is the complete opposite of that, in the sense how you see it. While other people see this as a change in society that, oh, we're committing murder, half physicians see this as a change to give a patient an opportunity that they might have not had, an opportunity to not suffer anymore. They are trying to help the patient in any way, shape, or form, in that meanings of committing suicide, in trying to treat this as best as they possibly can. But they want to help the patient in any way, shape, or form that they can, in whatever sense of the word help means to you. In the graph below, it shows how much strong views there are, and it's been growing over the years. Most people want to see physician suicide become legal and to give these people an opportunity to pick what they want to do with their own bodies, whatever that may be. Whatever decision they make, you have to respect it. It's not your body. No one should tell these people when they should live and when they should die.
So physician-assisted suicide is not easy for anyone, not the family, not the doctor, and not the patient himself especially, since he has to decide whether he lives or dies the next day. The patient is aware they're hurting their families if they choose to die, but of course they're in the most pain. Many actually believe they're helping their families when they're choosing to end their own life, since the medical bills will stop and they can plan accordingly when to say goodbye to their loved ones and what their last days will be. They'll be able to die in peace rather than pain.
At the end of the day, this is not a decision that's easy for anyone, especially the patient, but it's a decision that we all must respect. And whatever the outcome is, in their eyes, it's for the best for them, which at the end, that's all that's for. So next time you think about this controversy, put yourself in the shoes of that specific individual and whether or not this should be a legal procedure all over the United States, and not even just the United States, but all over the world.